Hi everyone, in this video we're going to talk about how to use Open Dental's planned appointments feature. Planned appointments happens to be the best feature of Open Dental, which is also the most underrated feature. I use this on a daily basis in my practice. So let's see how it's supposed to be used according to Open Dental also. So if, for example, if I'm looking at somebody's treatment plan, here's a test patient and I've got a treatment plan in place here. I've already prioritized it in terms of the next two appointments. So here's the priority number two. These are the procedures that I want to add, and there's a membership individual code because this patient is going to sign up for membership, whatever it may be. And the second appointment is going to be for implant crown impression, for example. All right. So general rule that I follow in my practice is every patient who has anything in their treatment plan should have at least one planned appointment in their chart. So how do you create a planned appointment? So if you've got a treatment plan in place, now we go to chart. Now let's say the patient is sitting in your chair in the operatory. You're behind the patient at 12 o'clock. Patient can't see the screen. You've got the treatment plan in place. You've gone over everything with the patient. Now in planned appointments, you go to the patient's chart. You click on the planned appointments tab. You would click add. And then let's say now I need to create a planned appointment, which means what is the patient supposed to come back for next? So I'd like to add the membership code. I'm going to add the crown and I'd like to do these 3 fillings. All right. And I can select how long I need, whatever it may be. Let's say an hour. Okay. Any notes that I want to add, um, whatever it is. Okay. And click OK. All right. And what I'd like to do also is add another planned appointment. This is what I would like to do next. Second appointment, I'd like to go ahead and do the patient's implant crown impression, 20 minutes. That's fine. I'd like to leave a note for my front desk in case the patient calls to schedule this appointment. All right. And so now for this patient, we have 2 planned appointments. The last column is going to indicate whether or not this appointment is actually scheduled. All right. So right now, this patient does not have any appointment scheduled on the books. All right. So 2 things can happen. You've got the patient sitting in the operatory. Now you or your assistant is going to ask the patient, hey, well, when's your next availability? Let's go ahead and get you scheduled. So usually once the patient commits to a schedule, I will just click on the appointment. I go on Pinboard, I pin it to the pin board, and then I can drag it to wherever on the schedule the patient wants to come in. All right. Let's clear that out. Let's say the patient does not want to schedule the appointment. All right. Well, now they don't schedule the appointment. However, immediately they should be added to your follow-up cycle, as we have already discussed before in previous videos or any other videos you may have seen for Teamio. If a patient walks out without an appointment and they've got something in their treatment plan, you want to initiate a follow-up cycle and you ask the patient, hey, when's the next time we can follow up with you to get you in? And whatever that may be, you can click on Teamio patient, initiate it on the scheduled treatment follow-up for this patient. All right. Now, let's say a week later, you're seeing other patients. The patient just happens to call back and speak to your front desk. And now your front desk is kind of wondering what the patient is supposed to come back for. They said, hey, I need to schedule my next appointment with doc. And now your front desk is wondering what they're supposed to come back for. They can actually just click on the chart. And if you're using planned appointments, well, now they know right away. Okay, I guess this patient has a planned appointment for 60 minutes. It's not supposed to be side booked. That's the note that's written in there. And these are the procedures. So now the front desk can easily click the appointment, pin it to the board, and while the patient is on the phone, schedule them to whatever time they want to come in. All right. So now the front desk is going to know everyone in the office. In fact, whoever has access to the computer on Open Dental, everyone on the team can see what this patient is supposed to come back for next and how long the appointment is supposed to be. All right. So anyone, in fact, the front desk, or if you've got a phone in the back in the clinical areas, you can schedule appointments from there as well. Okay. So every patient, the general rule to follow is every patient that has anything in their treatment plan should have minimum 1 planned appointment in their chart. All right. So now let's say these planned appointments are there. There's no appointment scheduled. Let's go back to this patient here. I'm going to go back to my unscheduled treatment page, and it's the patient here. We've incorporated planned appointments into the unscheduled treatment follow-up panel. So you can see it here. For this patient, when you try to follow up, well, you have a planned appointments tag. And the number 2 indicates how many planned appointments there are in Open Dental for this patient. And you immediately see all the information here. The priority, the procedures that are for each planned appointments, any notes that may be entered for that planned appointment, as well as the provider and whether or not they're scheduled. Okay. So now as the patient is following, as the front desk who may be following up with this patient, Before they follow up, they should be looking at not only the communication log, not only the follow up activity, but also if there's any planned appointments. So they know what they're supposed to call the patient for. All right. So this patient is supposed to come back for a crown and a couple of fillings next. Great. So now the front desk, whoever in your office is following up with the patient, can actually indicate, hey, Dr. Shah had treatment plan, whatever, and we just want to see when you could come in and go from there. All right. So I hope this helps. And it's very simple. Basic rule, as I mentioned, that's the rule you want to remember. Every patient, whether or not their appointment is scheduled, they walk out with minimum one planned appointment in their chart.